So in this chapter of neuropathic pain management, we're going to talk about emotional health, exercise, physiotherapy and sleep with a particular focus on Chiari pain and Syringomyelia. These are subjects that not many people deal with when talking about management of neuropathic pain, but they are incredibly important and should be considered just as much as drug therapy. Well, one of the most important things is that your brain, an animal's brain, has a great input from pain, and its actual circuitry is affected by pain. And we call this the corticolimbic circuitry, sometimes referred to as the pain matrix. And this is a very complex area of quite small regions of the brain that are interconnected, and they're throughout the brain, so you can't really say that there is one area of the brain which is the pain brain, but a lot of interconnected circuits, which is why it's often referred to as a matrix. One of the most important areas is the amygdala, and it encodes and consolidates emotional memory of events, because pain demands a behavioral response. The whole purpose of those C fibers that carry that nociceptive information to the brain is to learn from it. So you will learn that a particular experience or event was painful, and to avoid it in the future. Also important is the hippocampus, which converts that short-term memory to a long-term memory. And these areas regulate the fear response, and they activate that hypothalamic pituitary adrenal axis, which sounds quite complicated, but basically means your flight or flight response, your sympathetic response. The prefrontal cortex and the cranial cingulate gyrus, that's the one that receives all of this information and coming from other areas as well, and is involved in planning complex cognitive behavior, expression of personality, decision making, and moderating social behavior. And to give a very simple example, if a dog comes into, say, a veterinary practice and has a procedure which was painful, then the dog will learn that that area was associated with pain, and this will lay down a short-term, then a long-term memory of this being placed associated with pain, and therefore something to avoid. And then they have learnt that behavior, and they will then engage much more complex behaviors to avoid that. And as I said before, this is connected to the hypothalamic pituitary axis, your flight or flight response, involved in your decision making, your emotional regulation, and your memory. But it's also the modulator for the acute pain and critical for the chronification of the pain. And there is a functional and anatomical overlap, which basically means that if you are chronically stressed, poor mental health, then this may worsen pain and vice versa. So pain may predispose mental health problems in animals of all species. So it's very important that if an animal is in pain, they are at risk of poor mental health. And so you should focus on addressing their emotional compromise and increase that emotional capacity. And if you're interested in this, then I really would commend you to read Dr. Sarah Heath's writings on the emotional sink. So basically, if an animal has reduced emotional capacity, then that hinders their ability to cope with neuropathic pain. And assessment of emotional health should really be an integral part of the diagnostic workup of the patient with neuropathic pain. So to give you an example, an animal that's going through a stressful circumstance, should we say an at-home environment that is very stressful, they may be more predisposed to developing neuropathic pain, or more likely to show signs from that neuropathic pain. When you're assessing the dogs, you obviously have to consider their emotional bias and their arousal state. If they're very, very stressed in your veterinary environment, that might not be the best place to evaluate them. Better to evaluate them in their home space. Firstly, if they have an enhanced emotional capacity, then this can mitigate some of the impact of neuropathic pain. So this basically means assessing their own social and environmental factors that impact that. So for example, if you have a cat that's prone to, so we say feline oral facial pain syndrome or feline hyperesthesia syndrome, then their environment may make that disease more likely to express. So for example, cats are most easily stressed by other cats. So if they're constantly seeing or smelling the presence of another cat that is not part of their social group and is invading their space, shall we say a tomcat that's coming in through the cat flap or just even walking across their garden, then this may impact on their emotional capacity and make them more likely to show their neuropathic pain problem. So if you can actually address that, then you'll make their pain syndromes much less likely. Sounds easy, but can be quite complicated. So exercise, and here's some beautiful cavaliers that I enjoyed the company of at a recent Companion Cavalier Club meet. So exercise induces a variety of psychophysical effects, including altered pain perception. And if you do get a phenomenon of exercise-induced analgesia, because that produces endorphins or endocannabinoids. Basically, exercise makes you feel good. And when you feel good because of these endorphins and endocannabinoids, then that's actually just natural medicine, meaning you feel less painful. I think we all know the arthritic dog that drives through that pain because they're enjoying their exercise so much with no sort of consequence of what may happen once they stiffen up. And neuropathic pain is similar. And this is something that we can use as practitioners. So many times I see animals that have neuropathic pain, especially Chiari and Syringomyelia, where the owner has been told to restrict their dog, where there's no need to restrict their dog. Let them enjoy their life as fully as they can. So you should encourage, but with their own limits. Now, this is where it can get a bit tricky, because with Syringomyelia S, which is symptomatic or severe or scratching Syringomyelia, where they have a fictive scratch, and if you don't know what that means, there's some other videos on that, then ideally they should be exercised off leash or without their collar if their rubbing of their collar is likely to stimulate that scratching action. And it can be really limiting to a dog's ability to walk if their collar stimulates that fictive or phantom scratching action. Now, of course, this is easier said than done. Some people do not live in an environment where you can exercise the dog off leash, or that they just don't have good recall. And there are very, very few safe places, such as there are fields that you can hire sometimes, but there's very few of those where you can allow your dog off if you cannot recall safely. If a dog with Syringomyelia or other neuropathic pain is unable to exercise, and this actually may indicate more serious disease. And during aerobic exercise with Syringomyelia, the signs may be exacerbated because the heart beats faster with more force, which may slosh that syrinx fluid in the cavity. And some owners do notice their dogs are more likely to have signs when they exercise, which obviously will limit things. In humans with neuropathic pain, the vast majority of studies, and there's many studies looking at all types of exercise, the vast majority of them will suggest benefit, but a lot of them will suggest it's ideally tailored for the person, which is it really goes without saying. With Chiari malformation and Syringomyelia, you are advised against aerobic exercise prior to decompression, but for most people that's not something that they need to be told because they're not able to do it. However, after surgery, or if surgery is not taken as an option, then a study performed by the Anne Conroy Trust did find that exercise was the most effective complementary therapy, and specifically was hydrotherapy. And we don't have much treatment for Syringomyelia weakness, that is weakness due to damage of the spinal cord, really the only therapy that we have is physical therapy, hydrotherapy, controlled exercise, physiotherapy, and possibly surgery. And I would consider this, and I get much better results, much better results than ever resorting to drugs like corticosteroids. So with complementary therapy, remember, specifically with neuropathic pain, that they may have allodynia, which means touch can hurt. So it must be tailored to the individual. And that there is a great deal of lack of data with Chiari malformation and Syringomyelia, and really with any other neuropathic pain disorder. I do like to use complementary therapy and drug therapy when I can, because if drug therapy was so very effective, we wouldn't be asking for any other treatment. It would be completely effective. But the reality is, it's not all that the most effective therapy is associated with adverse effects. So anything you can do to help these animals get by on a lower dose of drugs is good. And this is one particular patient who made an excellent response to acupuncture. And I have to thank Dietrich von Schneinstitz here, who is, his website is a UK-based acupuncturist, he's worked with me with a number of my animals. So what is appropriate? Gentle massage, TENS, low-level laser therapy, ultrasound therapy, and as I said before, acupuncture. All of these can be very useful. What's not appropriate? Any kind of spinal manipulation, especially if you've not diagnosed the cause of the neuropathic pain. Because, and it's particularly in Syringomyelia and Chiari malformation. So that is translated as no chiropractic, please. You can do many little things to improve comfort and quality of life. And for these lovely cartoons, I have to thank Frazzled Cat, and in particular Cavalier Matters. We don't mean to pin their ears up. This is just a little bit of a joke here. This comes from the Cavalier Matters website. But we do see that Dougal here is eating with a raised food bowl. So if they have a pain that's affected by posture or valsalva, as you do with Chiari malformation, then raised food bowls and beds can considerably improve their comfort. And the other thing is just a little thing, but using a stroller, and this is actually just adapted from a regular pushchair rather than an old second-hand pushchair, rather than buying a new one. Using these strollers can mean that you can enable those longer and more interesting walks. So rather than trying to walk on the leash through the streets to the park, you can use the stroller. You arrive at that more mentally stimulating environment, and then you can let them off the leash to enjoy that. Sleep disturbance because of pain is incredibly important, and on average dogs spend about 10 hours asleep. When you are asleep, this triggers rhythmic waves of CSF and blood, and this washes out the brain of toxins, especially amyloid. And chronic pain increases the risk of poor sleep. But poor sleep is really detrimental. It enhances pain sensation, it increases your risk of developing chronic pain, it impairs cognitive and physical performance, it impairs your emotional health, increases behavioral problems, decreases immune response, and increases the risk of obesity and cardiovascular disease. So we really want to avoid that. So how can sleep be disturbed? Well, first and most importantly, if the animal is brachycephalic, that is to say short craniumed, and especially if they're flat-faced as well, then sleep disordered breathing. So they may have obstruction to their airway. And it should be said that snoring is never normal in a dog. It shows an obstruction. It may be that it's not a severe obstruction, but it's still an obstruction. And the other important thing is weight gain round their neck. You know, some dogs, they'll all go to their neck rather than other areas. And when they've got all of that tissue around their neck, then that can increase their risk of obstructive sleep apnea. And another thing that's very common in brachycephalicism is central sleep apnea. And sometimes we wonder if this is a Chiari malformation and they've actually damaged their brainstem because of the compression. There are human factors that disturb dogs' sleep. A pet's bedtime is very much influenced by the human. And some dogs, the ones that often sleep with their owners, they can only go to bed when the human goes to bed. And sometimes the human wants to stay up to past 10 o'clock, past 12 o'clock. And most dogs I know want to go to bed at 8 o'clock or slightly later. And so really we need to facilitate that the dog has a place that they can go to bed, even if it is your bed, before you go to bed, if that's what their inclination is. And sometimes the pet's sleep is disturbed by the human. Some of them are much more easily disturbed. But again, if you once a dog has gone to bed, you really should leave them alone. And the old wives' adage of "let sleeping dogs lie" is very, very true. And sometimes humans have very unrealistic expectations of dogs' activity. They think that the dog, being kind and looking at the dog's best interest, but they mistakenly think the dog needs to be occupied for so many hours a day, when actually what dogs tend to do is to have very high intensity bursts of activity, and then they sleep and they sleep and they sleep. And that's actually more abnormal, normal rather. So they don't need to have hours and hours of walks, then obedience work, and then scent work, and then agility work. And some dogs we see with behavioural problems are simply exhausted. And that is why they have the behavioural problem. So sleep disordered breathing, how do we recognise this? This was defined quite nicely by Tom Hinchcliffe in this study here. So waking up breath holding or in distress with gasping or choking, waking up going low levels of activity or sleeping while sitting or standing, so falling asleep while sitting or during periods of interaction. Breathing interruptions or apneic episodes, and seeking a specific sleeping position. So sitting with a chin elevated. Of course, some dogs with Chiari malformation will also have their head elevated. Trying to sleep in a seated position, or trying to sleep with something stuck in their mouth. And very, very sadly, you see these on Instagram reels and TikTok reels all the time. With people thinking it's hilarious, and it is so not hilarious to see an animal with a chair leg stuck in their mouth or a toy stuck in their mouth, just because that's the only way that they can oxygenate during sleep. And it's not funny at all. And this is because dogs are obligate nasal breathers when they're sleeping. So they can cope during the day because they can open their mouth, but they cannot cope at night. And that's why the only way they can get around it is to shove something in the back of their mouth so that they can sleep. So how do we manage this poor sleep? Well, obviously we have to optimize pain management, because it may be that the dog is waking up painful, and then that is causing them to have to move around. I would suggest that if they have Chiari malformation or Syringomyelia, that they have a bed which allows their head to be higher than their body. And there are as many of these beds around, some sort of like hammock affairs, which their dog's back end sort of dips down lower. Excuse me. Some beds which allows them to rest their chin up. If they have sleep disordered breathing, if you're suspicious about that, obviously seek your vet's advice, perhaps take some video of them sleeping, but they need to have investigation of BOAS and appropriate surgical management if necessary. And appropriate is, I must admit, I try to refer to a specialist in that area, because it's often far, far more than just trimming the soft palate. And that's often not enough for these dogs. And of course, if they've got a lot of weight around their neck, then the very best thing you can do cheaper than anything, a much more lower risk, is to lose that weight around their neck. So the dog breeds that are particularly prone to doing that are the Pug and the Cavalier King Charles Spaniel. If they have central sleep apnea, again, this is something that only a vet can diagnose. And I know there'll be some vets listening to this. And so this drug here, on danceteron, which is a 5-HT3 serotonin receptor antagonist, has been shown to decrease the frequency and the severity of sleep disorder breeding episodes. And one may worry that because it's a serotonin antagonist, I certainly did when I first prescribed it, that it might affect neuropathic pain, because serotonin is useful for switching off neuropathic pain, but it doesn't, at least in laboratory models. Sometimes I will use melatonin as an easy supplement that owners can give their dog if they've woken up. Sometimes I'll use valerian for the same effect, which is a herb which can cause sedation. I put question marks though, because they're completely unvalidated, and some humans that use this find that it makes them feel groggy as a result. And there actually has been some human meta-analysis studies that have suggested CBD oil. And if you want to know more about that and the risks of that, then there are other YouTube videos. So I hope that this little gamble through all of these different facets of managing neuropathic pain has been useful to you. And I will say goodbye. Bye.